Welcome back. June is Men's Health Awareness Month, and did you know that infertility is also affecting males? Well, East Cooper Medical Center's fertility expert, Dr. John SCHNORR, has details on how common the male factor infertility is. Good to see you, Dr. SCHNORR.
Can you believe male factor infertility? It actually exists?
Well, I wouldn't really think about it, and I would think that a lot of men are actually kind of embarrassed about it and don't want to talk about it.
Yeah, it's a very nervous time for a male waiting for his semen analysis results to find out that he may or may not have a cause of their infertility. We now know that male factor infertility is about 35 to 40% of all cases of infertility. So pretty common,
Getting close to half almost.
Yeah, pretty common. And so it's really important to do an initial assessment of the male factor infertility, which is a simple semen analysis.
Okay, and I bet a lot of men out there are saying, hey, I'm the manly man, and it couldn't be me. I'm the one that's going to carry on the family.
Yeah. And often there aren't any red flags. Often they have a very normal medical history, nothing that would make you think that it's male factor infertility. But we know of hormonal causes and genetic causes that can be cause of that. There can be anatomic abnormalities such as varicoceles, undescended testicles, a variety of different things.
So you might not even know you have this.
Often not. Most couples don't know.
Now, one of the big things I would imagine, you said genetics.
Yeah.
If your father, how does it go? Is it like baldness, skips a generation?
It's a good question. Normally it's tracked right on down on the male side. Okay. And it can be either a genetic abnormality or it can be translocations of the chromosomes themselves. And a lot of these men will have male factor infertility that's a low enough sperm count that they eventually can conceive. It just takes longer to conceive, so they can pass it along.
So who are the gentlemen that you normally see? Are they the ones that have been trying to have a child for a while?
Yeah, normally couples come in after trying for 1 to 2 years. They're trying to get pregnant without success. We do a very basic evaluation at that time, and if we identify male factor infertility, we can then fine-tune to figure out the cause and then find a treatment for it.
Now walk us through the initial appointment that they come in to you for.
So generally an initial new patient visit includes an hour with the physicians at Southeastern Fertility Center. We do a semen analysis before the visit so that during that visit we can review the semen analysis results.
Oh, wow. Yeah.
So we have instant information. We then do some testing of the female during that new patient visit. And at the end of the new patient visit, have a good idea as to what direction to head for both testing and for treatment.
I was going to say, because that's the goal in the long run, is to have a child. So what are some of the things that we do for treatment?
So a variety of different treatments. One might be simple things. Avoiding jacuzzis for long periods of time. Bike riding excessively can, in rare cases, be a cause of male factor infertility. Believe it or not, alcohol consumption, hard to say, but it can be a problem.
Well, that's just with any health
Tobacco use, yeah, absolutely. A variety. Sometimes medications can be a cause of that. So look for an easy solution, and if there isn't an easy solution, we have more sophisticated forms of treatment that can allow almost all men to conceive.
Now, have doctors found also that maybe a healthier diet, things like that, can help infertility?
We think a well-balanced lifestyle would help both men and women conceive, no doubt about it.
Okay, so if we are going to come in, how do we get a hold of you and set up that first appointment?
You simply call us at Southeastern Fertility Center. The phone number is 843-881-3900. We'd be happy to set up a new patient visit and get the thing started.
Now, do you think also that some men out there are embarrassed and don't want to call you?
Absolutely. I mean, it's a big step to move forward and actually admit you have infertility, number one, and number two, that it could be your cause.
So you make it comfortable, you make it easy, and
just see it as a disease, just like you would any other disorders like asthma, diabetes. It's a medical disorder, and fortunately we have fantastic success rates that a couple stepping into infertility treatment has over a 90% chance of success.
90%?
Over 90%
That's
with
huge.
Continued treatment.
So you really have to focus on that light at the end of the tunnel.
Exactly right.
Well, Dr. SCHNORR, thank you so much.
Thank you. Appreciate it.
And feel healthier already. All right. Well, it's proved once again true that you're in luck. We've got the next Service Master Clean coming up. We're going to see what they got coming up for us with the River Dogs after the break.